A very good morning, attendees. Welcome to Osteoporosis and Fall Prevention Festival organized by Cytacom Health. My name is Huda and I'm your MC for today. Let's welcome our esteemed speaker, Dr. Tan Chit Seng, who is trained as a medical doctor since 2002 and has worked as a physician in Singapore throughout his career with a short posting in West Bengal, India. Throughout his 20 years career in the medical field, Dr. Tan has worked in public, private, military, and charitable organization setting. Today, he'll be talking about innovations in fall prevention and exercise. Please take note that you're only able to ask questions during the Q&A session at the end of the talk, either through the Q&A box, chat box, or you can raise your hand and we will unmute you. Now, I'll pass the time to Dr. Tan.
Hello, everybody. Thank you so much for having me today to share some of my ideas and the latest innovation on osteoporosis and fall prevention. So right now, the first thing I have to do is to share my slides. Okay, I hope everybody can see my slides now. So I'll be talking on the topic of innovations in fall prevention and exercise for today. Okay. PowerPoint. Okay, let's do that again. Okay, so this is my first, very first slide. So what do I think about fall and osteoporosis? I always talk to my patients, and actually those that are the caregivers of my patient, that fall prevention is the #1, strategy for osteoporosis as well as fall prevention. Prevention is much better than cure. Everybody of us know it. But are you doing what you should be doing today? Is your home fit for a person to live in safely without the fear of fall? Are you as an individual doing enough to prevent yourself from falling, or if you have fallen, to prevent serious injuries to yourself like osteoporotic fractures? So that's what I'm going to touch on today with the use of technologies and innovation. So of course, these two slides you can all see. One is on the environment and one is on the individual. Both are equally important, and both, I can shed more light. You can see that, the picture on the left side, it is a recipe for fall. All the Legos are there. You step on you develop pain, you get imbalance, you fall down. So this is truly a home with a lot of fall hazards. And how about individual? Two things that you actually need to prevent falls. One is muscular strength. If you are stronger, you are more steady, really steady, then less potential for you to fall down, even if you lose balance. And of course, flexibility as well. If you are very flexible, you can realign yourself very quickly, and you may not fall so often as well. And these two, actually, the most important factors is to do the functional exercises. And of course, nutrition. You cannot be training and not nourish your body with good proteins to build muscles. So if you cannot remember anything from my talk, just remember these three things. The home must be safe. You must have enough nutrition to make yourself strong, and you must exercise for strength and flexibility. These are just the three things that I want everybody to remember today. Okay, so let's go on to my next slide. So Team Strong Silver, which is also part of this osteoporosis and fall festival, these are the poster boys. Okay, and there's another ladies group called Team Phoenix, I believe. They are the one that represent the ladies part of the story. But you see, they are in their mid 60s, early 70s, and probably they have more muscle than me, and they are very steady. If you look at them working on the monkey bars, doing push-up, stacking themselves, doing push-up, they are incredible. So I would really want to be like them when I'm their age, and hopefully I'm trying to, you see. So, but these are the people, that are really, really built to, for fall prevention. And if you can see the ground, the ground is a bit soft, so that when you fall, it cushions the fall. So that is the environment. If you are renovating your house now, you may consider, some less impact flooring that is more, fracture proof. There are such materials that we use in the geriatrics hospital here. So you could actually inquire your home designer for this kind of material, on the flooring. So next slide. So like I said, the most important thing about osteoporosis and fall is the prevention. We have developed one of the app called WellFamily House just to target this falls, memory, social isolation. I will share with you the app now. This app, unfortunately, has not been rolled out formally by any organization yet in Singapore. And I'm hoping that if interested organization would want the use of this app, please do contact me. So let me stop sharing my slides here and maybe show you the app proper. Okay, let's share screen. Okay, if you can see, this is my handphone now. I actually have a SATA Home Health family that I created, but there are no members yet. So the members are only myself, and maybe if, let's say, for example, SATA as an organization starts a program like that, for fall and prevention of falls, they could have the members in the members group, and they can update the members on all the news that they want the members to know, you see. So this is an app that you can download from any smartphone. So today I'm going to actually look at more of the fall prevention. There is two categories of this: dementia prevention and fall prevention. Dementia prevention, maybe I quickly go through, is to use space interval training, where you can select a number of words, 1 word, 2 words, 3 words, and then you must remember that word in specific periods, 1.5 minutes, 5 minutes, 10 minutes, and 20 minutes, and 30 minutes, just to train your brain every day to remember. So memory is also a muscle, and we need to train the muscle for the memory. It is very good for people that are worried about, their memory, getting worse, you see. And it's a form of training that is proven clinically, actually. Sound of music will be the one that, we listen to music, in the olden days, and then we kind of think of the past and we write out the stories of our past. That is what we call reminiscence therapy. Okay, so these are more of memory muscle training. Of course, today we are talking about physical activities and fall diagnosis. So in this app, we have a few categories. We have the fall self-diagnosis, physical ability assessment, and risk environment assessment. So I'll talk about the environment first. So when we click here, you can just click the first one, master bedroom, and you go through, all the things. Is there light? Yes. Is it easy to turn on and turn off? Yes. I would recommend with technologies now, you can also use voice activated. I use voice activated, using Google Home, and that can activate the lights anytime I want using my voice. So it's much safer. Well-organized sheets, do they touch the ground? All these are factors, When you sit on the bed, does it have a proper height? Not too high, not too low? Can your toes be placed on the ground? You see? And then you can take a photo and we can have a look at it, you see. So then next, you go to another category, if you want the bathroom, living room, kitchen, stairs, if you have stairs at home. So maybe the first four will be, or the first 1, 2, and 3 will be important places that you assess whether your home, your house is safe, safe from accidents. And of course, other than that, the second is your fall self-diagnosis, then you see whether, have you had falls, in the first year, if you say yes, are you taking more than 4 types? You know that polypharmacies means 5 and above medication they are taking. If you're taking more than 5 or more, then you are at risk of falls, because polypharmacy is related to falls as well. So yes, let's say if you have difficulty in walking and standing every day, maybe most of you will be no, maybe not really that yet, assistive device. Do you feel your lower body and feet unsteady? Sometimes we do, you see. Are you afraid of falling? Some people, after the first fall or the second fall, they are so afraid of falling, they don't ever walk much again. And that is not good, actually, because the muscle will be wasted, sarcopenia will set in, and, things just become worse, So are you afraid of falling? Maybe not yet. Eyes, vision is very important for balance. So for older adults, sometimes they develop cataracts and they may see well in the day, but at night, because they can see better in the night than in the day sometimes. So, seeing is very important for your balance, which is very important to prevent falls. Okay, let's say you yes. Hearing is also another problem, Osteoporosis or other diseases affecting the ear, middle ear can affect the balance as well. So you can have spinning sensations, tinnitus, vertigo and all these things. And that can affect your balance as well. That's why we want the ears to be checked out as well. And of course, when you're walking in the community, if you can't hear the traffic, then it's a risk of accident as well. So hearing is very important. And let's say no for this. You work out, maybe not. Drink alcohol, some of you maybe yes, maybe no. I'll just put maybe yes. Okay. Suffering from 3 chronic disease, maybe yes. Okay. So warning levels, you may be at risk, and you may want to, be more careful on the falling, you see. And then if you are at risk, you better do a physical ability assessment, So there's a physical ability assessment part in this, which you can get yourself, your caregivers, together with your caregivers, definitely. I don't want you to fall, doing this assessment. So a caregiver is there to help you, to start the assessment. You can start all the normal balancing and all the other movement and leg strength assessment to see whether you yourself are on the high risk of falls. If you check all this and you're all on high risk, you better do something. There's no point checking and not doing anything. So you better, find some help. A gym membership will be good. And improve your nutrition and make sure that your home is free from fall risks. You see. So what about the exercises? What exercises do we do? So in this app, we will give you the physical therapy, exercises to see, and we have I think quite a few weeks of exercise. So week 1 all the way. Let me scroll my yes. So week 2 week 3, you know, all the way to week 12. These are all functional exercises, you know, and these are all exercises below to tell you about position and posture. So let me open one for you and help you to understand a bit more. So let me click this one. Let me start.
Sit upright on the front edge of the chair and march slowly.
It's not going to be very difficult. So the basic one will be very basic.
Keep doing it about a minute. Move your arms back and forth.
Yeah. So
and march a bit high.
I would suggest you have to have a supervising person, you know, a caregiver beside you when you are doing this.
In place.
Or in a video tele rehab, you know, service, you know, that we can do it all together.
Relax your shoulder.
Yep. So the good thing about this app is everything you do in this app will be recorded. And then, you know, your members, the member of your family basically will be able to see whether you are doing well, whether you have done all the things, you know, we can actually track your improvement. So that is something that is good about this app, because your so-called trainer or your so-called health coach can actually track what you have been doing. Are you doing every day? Are you getting better? You know, then we can have the assessment again before the 12 weeks or after the 12 weeks or in between the 12 weeks to see what is your muscle and strength progression. So this is an app that I'm introducing to the Singapore, and hopefully organization will be interested to, you know, run a service based on the activities in this app. Okay, so I'll stop sharing the app now. Now I will continue my slides. Give me a minute. Okay. Share. Okay, so this is an app that is called WellFamily House, which I just went through with all of you. And the next slide will be functional exercises. You know, we have a lot of gyms now in Singapore that use her equipment, which I think in 2015, you know, 2014, we are looking at this set of tools from Finland that uses air pressure instead of the normal weights. I believe there's another session on her equipment by the her themselves, I think tomorrow. So I will not elaborate more on this. But basically, it is very safe for older adults to use because there's no recoil. It is using, you're pushing against air pressure and not balancing the weights of the weight. So it is very safe. And of course, flexibility, like I said, inside our app, there will be flexibility exercise to improve your strength and your flexibility. And these are what we call functional exercise. So we had a study that's done by the Jerry, which is a geriatrics education and research institute in Singapore, about 3-4 years back. I can't remember. I was the screener for the patient at the time. So we proposed a 12 weeks functional exercise regime for some of these older adults. And pre and post, there's a significant difference in terms of their functional ability and their flexibility. So, yep, do take note that this one, all this must take time and effort. Without time and effort, it's very difficult to achieve. So when we talk about prevention, you can prevent all you want, but unfortunately, accidents still happens, especially at home. I mean, if you're in a community, you know, you fall down, there'll be a lot of people around to help you, you know, you feel safe. But what if you're at home and you're alone at home? You know, if you fall and you couldn't get help quickly, actually that is very bad, because there's a lot of studies that shows that the time that the person stays on the ground without help is quite associated with the mortality and the mobility of the person. So if you stay on the ground, the longer you have worse outcome. So we want people to feel safe in their own homes as well. And we have newer technologies, from one of these is from SoundEye that monitors for falls at home. So basically it's a device that is like your Google Home, your Alexa, and it actually monitors for sound. The sound can be from the fall of a human person. The system is smart. It can detect from a book falling to the ground and a human body falling to the ground. You see, so if he is always listening, if he heard a sound of a human falling to the ground, he will raise the alarm, and of course he will raise the alarm for any shout for help as well. Any abnormal shouts, any abnormal noise, basically, that will trigger a short recording of about 3 to 5 seconds of the sound. And this 3 to 5 seconds of the sound will be transmitted to the monitoring service. Okay. How it works is that, in the past, people wear panic button, but panic button must be worn. And most of the people, after 2-3 months, fatigue about the technology, they will not wear it anymore, and or you get a phone call, you must reach the phone call, or you must be alert enough. You must not be in the coma when you fall, to be able to call. And you got to, or if you can still pick yourself up to walk to get the person that is you call for help has to go all the way to confirm or to support. So what happens is in this device called GoGo SoundEye, you put them in the house, they are going to monitor the sound in the house. So if there's a normal sound like a human falling or basically a shout for help, some abnormal noise, the monitoring people will get alert and they will play back the sound that SoundEye says is abnormal, and they can verify by talking into this device, and this device will actually be heard by the patient, and the patient can talk back without even moving to verify whether that there's a problem and needs support, and we can actually trigger the police, the fire engines, and the ambulance, So there's nothing for the older adults to wear. There's nothing, no button to press, like, the big buttons there is in all our studio apartments, one-room flats, There's no intrusion of privacy because we are not listening. We are just monitoring for abnormal sounds only. No need to log in, nothing as well, no maintenance. Okay, so basically you just plug in and then that's it, So it's very, very easy. So the alarm and the alert must go somewhere. So who are the people that will be receiving this for support and rescue? I don't think the ambulance service or 995 is doing this kind of monitoring, or they want to do this kind of monitoring yet. So I guess the first line of monitoring would be from the family themselves. So, alerts can be sent to their families, and the families can actually talk to the person through the loudspeaker in the device itself to ascertain whether the older adults is safe or they have fallen. Organizations, for example, SATA can have a service that monitors for falls at home for a vulnerable group. And they can charge a small service fees and maybe subsidized by the government if the government feels that this problem warrants some form of more support. And of course, volunteers. So one of the biggest volunteer groups is SG Assist in Singapore, where they have volunteers, a group of volunteers, and they will monitor their handphone if there's a so-called alert or request, and those that are free and nearest to the patient can maybe render some help. So these are a few of the community support that are currently available and ongoing. So with that, let me, for the last 5 minutes of my talk, let me summarize and recap what I have said. So the most important thing is 3 things if you cannot remember what I said today. One is to make sure that your home is properly designed and there is no fall risk, inside your home. So your home must be very safe, okay, to prevent accidents from happening. Then the next 2 are based on the individual. You must build up your body, build muscle and flexibility. How do you build muscle and flexibility? 2 ways. And these 2 ways must be done together, not just do one, not just nutrition, not just go and eat good food every day. No, it does not work. So, of course, good nutrition food is important, but you have to exercise also. Convert all the proteins that you're taking into muscles. And not only muscles, big muscles, but functional muscles. Muscles that can prevent you from falling. Not just big biceps. Big biceps may not be so useful in prevent you from falling, you see. So you must know functional exercise will be more important than just, doing weightlifting and, getting muscles that might not be so useful. It must be functional type of muscles. So secondly, of course, fall and detection. So like I said, we have a lot of devices that you can put in place at home now to monitor for falls. And the least invasive one will be through the monitoring of sounds. Of course, you can put CCTV at home, no problem as well. But if you put CCTV at home, the family will be the only people that can monitor the patient, nobody else. If any organization wants to monitor the CCTV, we have to get a police license. I'm involved in some of these projects as well, so I know how leceh and how difficult it can go. So using sound, it is safe, it is accurate, and it also provides instant two-way communication. So that part is very, very helpful to, understand what is the current situation and how urgent the situation is. And of course, the last part is, you must have a group of people other than your family to be able to monitor and provide help and support when it's needed. This is actually one of the most difficult part, but with big organizations that are focused and willing to do so, I think it is very possible. With both the technologies that I actually explained previously, all these 3 comes together, you will be I will believe that it will be a very good system and platform to prevent falls in the older adults in the community. So I was told that I have 30 minutes and I kind of finished my 30 minutes now. So I will now be happy to answer some questions that you may have. I will stop sharing my slides now. Okay. Okay, so let's see. I have actually 2 questions here. One is from Alice. For fear of falling, Grandpa used the hand wheels at home to walk. He sort of roll it. Is it ideally good for his muscles? So he's using a rollator, I suppose. It is quite a stable product, and it has wheels in front. And actually, I don't think it is good to roll because that will be a bit higher risk for falling. If he rose too fast, he couldn't get the grip of his foot, he may fall. So I guess it's definitely better to walk than to sit down. That is for sure. But whether you walk, you have to walk properly also. If you are trying to walk too fast and you cannot cope with it, you know what we always call 信心大过于能力. And when I talk to old people everywhere, their sense of their ability is always higher than their physical ability. Unfortunately, I probably will grow old and become like that as well. But you know, most of the older adults, if they have a bit of cognitive impairment, you know, 信心大过于能力 is one of the risks lah. 信心大过于能力 translated means that you have more confidence in your own ability of yourself than your true ability in practice, in reality. So I guess it's always good to walk more, but you must walk safely. That's my answer, basically. The next question is exercise app. Yep. So for the exercise app, we need to actually have an organization. I don't give the app person to person and let them use and with no monitors. So I would need an organization that wants to take up the project, you know, to actually monitor the person. You see, I don't feel good if I just give something to person and I don't monitor it. And I don't think it's safe as well. So the third question is, my mom has knee pain and quite reluctant to walk for exercise. May I know what exercise you can walk? Okay, so basically osteoarthritis is one of the quite a big problem for functional decline and sarcopenia, osteoporosis. So essentially, a lot of times, right, if we have a lot of strategies for osteoporosis or knee pain, and we have to target the problem first. Some people use surgery. Some people, you know, use some form of equipment, you know, not really prosthesis, some guards to put into the knee to help align the knee and straighten the knee so that, you know, you walk, you don't get so painful. And a lot of times, right, when you get pain when you walk, it's because the muscles itself is very weak. So the muscles itself is weak. When you walk, the joint is not steady, it causes more pain. A lot of times when your joints are strong, right, your muscles around your joints is strong, keeps the joint stable, you have much less pain. So ideally, I would suggest that your mom should go and see a physiotherapist, you know, and with the physiotherapist to prescribe some exercises that she can do with the physiotherapist supervision to increase the muscular strength, you know, and maybe have sometimes you have to solve the pain first, you know, some painkillers, injections and all these to actually help with the pain first, and you got to walk lah. If you don't exercise, you can never be strong again. Yes, the go-go, the next question by Charlene, the go-go devices are available. And if you want, I'm happy to link you up to the company. No issues at all. You just get SATA to, you know, for my contact details. Yeah, there is no issues at all. And okay. Okay, so that is the question that the chat. Let's see. I know. Okay, so the location of SoundEye. Let me show you my slides again, and that's where we actually put it in the SoundEye in the home. Hold on. I have one slide on that actually. It's a small slide. I didn't make it very big, but yes. So this is the slide. So basically, we can put it. Let's say in the bathroom, we can put it on the ceiling. Then maybe the living room, kitchen room, we can put it against the wall. In the bedroom, we can put it at the side table, you know, beside the the side of the bed that the elderly is sleeping. So these are a few places that we will put lah. And these are the places that people fall usually: the bathroom, the kitchen, the bedroom. Yeah. So let's stop share again. Okay. Yes. So a lot of people are interested in the exercise. Well, I mean, you can contact me, and we'll see how we can do, because I'm very afraid to just give the app out and then people just do and there's no supervision. That is my biggest fear lah. So it needs a system or in charge in place to monitor all these exercise, because previously when we screen for exercise, we screen for the high blood pressure, everything first, make sure that the person is actually fit enough to undergo exercise before we actually start the exercise. And I myself is an exercise prescription. I can prescribe exercise for elderly. In fact, that's what I did. So I know about a lot of loopholes, or accidents that can happen if you don't properly screen the older adults first and make sure that the regime is safe for them. And that's why the app isn't just given to anyone, and let them do it on their own. So I'm less keen to do so. Yep. So no worries. Whoever wants my slides, I'm happy to give, and more of the let's say SoundEye information, I'm happy to give. Not an issue. Just one SoundEye. If you have just one SoundEye, then you just put it in the place that you think that it's the person can fall the most chances of a fall lah, but usually we will put about 2 or 3 lah in the home, just to make sure that every corner is covered. We do have a project in the Changi Airport with SoundEye as well. Yeah, I think pre-COVID, is it? Yep. So anything you need from me, I will be happy to share the slides. I will give one set of my slides to the organizers, and the organizers is free to share to anyone. And I have my contact in the slides, and if you need to, just email me from the email, and I'll get the relevant people to get back to you. Cost-wise, I'm not too sure about sound. I don't think it's very expensive. Yeah. Yep. Like I said, I will be giving out all my slides. No issues. Why not this way? I'll give my slides plus SoundEye's deck to all of you. Then you can have a look at the system and see whether it's interesting to you, and you'll be interested to get some of these systems. Okay, let's go. Any other question from the chat? So, yep. So I think that is what I am seeing now, and I more or less answered most of the questions. Is there any other questions? I'm a long-term home care doctor. I'm a disability assessor. So basically, I do assessments for disability so that the patient can get, claims like Elder Shield, Elder Fund, CareShield Life. And I do, mental capacity assessment as well, so that they can get deputyship. So these are the main things I do, and long-term home care as well. So I see quite dependent patients most of the time. So if SoundEye records a fall, who monitors extent to it? Yeah, that's what I said. This is a very good question. And this is the biggest problem actually. So let me share again my slides. So let's say that the person has fallen, oops, hold on. Let me just share my slides again. Let's say that the patient has fallen, and there is a few people that can get some help. the family, for one, is one, organizations and volunteers. That's what I have written here. So a few options. Family is definitely the first option, but they have to be on guard, basically, to monitor, which is not easy. And organization, so there are a few 24/7 organizations in Singapore, for example, Careline, so basically, if they are interested to set up some of these processes, it is very possible. And of course, volunteers, like I said, from SG Assist, that is one of the volunteer groups that can integrate and then get the alarms, and see whether any volunteers can listen to the sound and talk to the person directly at home and see whether there's any help needed. So these are the three ways, but definitely this is the biggest problem, who to monitor, and I don't have a good solution on that yet. Okay, let me unshare again. Okay. Yep, my email address I will give you via the SATA. I think that's the correct procedure to contact SATA first, and then they will pass you my contact. If you have diagnosed with osteoporosis, how much and how long exercise can you do? Basically, osteoporosis, after the BMD, after the doctor says that you need injections or you need to take the alendronate every week, well, I think exercise is still a very, very important aspect, because you are taking in calcium and you need exercise to stimulate the bone to take in the calcium to be stronger. So exercise, I think exercise is the #1 treatment for osteoporosis. Then #2 and #3 are the pharmacological, treatment, and other treatment, nutrition supplement. But without exercise, right, just by taking in the medicine, right, of course there will be help, but I think I believe that it will not be as good as exercise itself. Yeah, I do not have a clinic. I'm a long-term home care service, so I visit patients at home. So fortunately, I don't have a clinic, because it's not easy to run a clinic in this pandemic. I'm still working directly to the patients. So I see my patients from the day they see me until the day they migrate from Earth, basically, and along the journey, I support them. So I understand a lot of stress, a lot of difficulties the caregiver face. And even myself, I get stressed, depressed on my patients, situations as well, because we become quite close after 5 years, after 10 years. So, but I only see my own patients, the group that is referred by the hospital previously. Yep, so definitely, like I said, exercise is important, and weight-bearing exercise will be good for the osteoporosis, and flexibility exercise is to prevent falls. So both types you have to do, and you got to go to the gym, or you go marketing every day, carry heavy things. I think that is also good. But you get osteoarthritis after that if you get too much, because the joints. So when you have strong bones, strong muscles, then you have to look after your joints. That is the thing. If your joints are causing you problem, then you have to solve the joints problem as well. Okay, yep, I think my time is nearly up. I have about 45 minutes, which I've used up. So maybe I will pass back to the MC. Thank you so much for inviting me. And thank you so much for having me, giving me the opportunity to speak in this forum. Thank you.
Thank you so much, Dr. Tan, for the beneficial sharing. And thank you so much, attendees, for your participation. I hope you have enjoyed this session, and I hope to see you in other webinars that we have organized. If you are interested in the contents that Dr. Tan shared earlier, feel free to drop us an email at mediacontact@sata.com.sg, or you can call our hotline at 6244-6688. I repeat, 6244-6688. Stay safe and goodbye.